Understandably, many patients worry that if they have a lot of low back pain when they are in their 30s or 40s, the pain will become much worse as they age. However, many pain management and rehabilitative options are available for degenerative disc disease. If patients can find a way to manage their back pain and maintain their function, the prognosis is quite favorable. The long-term progression of disc degeneration involves the inflammatory proteins within the disc space. These proteins eventually burn out, causing the disc to become stiffer and the pain-generating micromotions to decrease. The degenerative process of the spinal disc may start gradually or suddenly, but progresses over 2 to 3 decades from severe and at times even disabling bouts of pain to a state in which the spine is restabilized and the pain is diminished. Alongside the disc, the joints and the vertebral bones may also be affected by the degenerative process. Supporting muscles, blood vessels, and nerves can also be affected. Aging of the spine may be associated with other degenerative conditions, including spinal osteoarthritis, osteoporosis, spinal stenosis, and degenerative spondylolisthesis. Spinal osteoarthritis. Small facet joints can become strained when the disc loses its structure, accelerating the degeneration of the joints. Osteoporosis. The degeneration of the bony structure can increase the risk of fractures in the vertebral bones, contributing to overall instability and aging of the spine. Spinal stenosis. A narrowed spinal canal can occur as the discs flatten, stiffen, bulge into the canal, or strain the facet joints. Degenerative spondylolisthesis. One vertebral body can slip over another, possibly due to degeneration of the facet joints, which may be a consequence of disc degeneration. While degenerative disc disease itself may have a favorable outlook, other degenerating structures can sometimes affect nerves or blood vessels and lead to a variety of pain symptoms. The level of disc degeneration is common by the 6th decade of life and beyond, when risk of pain from a degenerating disc is greatest. Degeneration can also start at a younger age, but pain does not always accompany disc degeneration. In fact, it is common to see degenerated discs on medical imaging in someone who has no spine-related pain. Magnetic resonance imaging has contributed a great deal to our understanding of degenerative disc disease and the natural degenerative process. With the advent of MRI technology, good anatomical detail of the disc can be imaged and correlated with the individual's pain. Studies with vertebral spine MRI scans collectively show the likelihood of degeneration with age. 37% of pain-free 20-year-olds have disc degeneration, and 96% of pain-free 80-year-olds have disc degeneration. Aging may be related to degeneration of the spine, which is not always a painful process. Health practitioners can determine if spinal disc degeneration on an MRI scan correlates with clinical symptoms of a degenerating spine, such as lower back pain and stiffness in lumbar degenerative disc disease or neck pain and stiffness in cervical degenerative disc disease. In the span of 20 to 30 years of degenerative disc disease, decreasingly frequent flare-ups of pain can be managed using exercises, self-care, and additional treatments. Often these management techniques can also alleviate chronic symptoms of pain within a few months.